Hello, everyone. Welcome to the COVID vaccination question and answer session. I'd like to firstly acknowledge the traditional owners on the lands of which we each respectively meet. I'd like to pay respects to elders past, present and future. I'm right now on Wurundjeri people land. I'd like to also acknowledge Aboriginal and Torres Strait Islanders who have joined us this evening. I would also like to acknowledge our deaf leaders who have provided this rich legacy that we now enjoy and the culture we can now have extraordinary benefits from, where we use our access and our inclusion to our best ability and we grow every day. So I'm really looking forward to this evening. We have Sarah. Sarah P is a nurse who specialises in vaccinations and immunisation. Sarah will answer your questions around the COVID vaccinations to help you understand more about what's involved and how you can receive that information so you can make a decision about which vaccine is right for you. Thank you very much, Sarah, for your time and your willingness to join us this evening and answer questions from the deaf community. So we currently have, tonight we have three methods in which you can ask questions. So you can join us on the Zoom, this Zoom we're in now. You can turn on your camera and ask your question in Auslan. You must raise your hand. So there is a function down the bottom of the screen where you can raise hand, or you can, in the Q&A section, there's a thing called Q&A, and you can write a comment or a question if you don't want to be identified. If you want to remain anonymous, you can use the QA function to do that. Or you can ask questions on Facebook. So this Zoom is now currently connected to Facebook and live streaming from Facebook. So please ask your question in the chat function in Facebook. We have Sam Martin watching the Facebook commentary, also our Zoom commentary or questions rather, and that's the way we'll be able to accept your questions. You'll be able to ask questions about the vaccines. We have Sarah, an experienced nurse with experience in specialised immunisations, and you can also ask questions around our Vaccine Hub, which we have at Expression Australia this Thursday and Friday. So you can ask questions about those things that we will be doing on Thursday and Friday. So I'd like to start by asking the first question. Sarah, there are three different types of vaccinations: Pfizer, AstraZeneca, and the third one is Moderna. What are the differences between those three vaccinations?
Thanks, Sarah. The vaccines that are currently available in Australia, there are two mRNA vaccines, which refers to the way that they work, and they are the Pfizer and Moderna vaccines. You may also hear them spoken about as Comirnaty and Spikevax. So AstraZeneca vaccination is the third vaccine available, and it comes as what we call a viral vector vaccine. Its other name is called Vaxzevria. So currently with the three vaccines, they are all fabulous at preventing death or severe disease in with COVID-19 disease. So what we are doing with these vaccines is trying to keep people out of hospital and particularly unwell with COVID-19. All three of these vaccines need 2 doses to give you excellent protection against COVID-19. The Pfizer or community vaccine is recommended 3 to 6 weeks apart. The Moderna or Spikevax vaccine is recommended 4 to 6 weeks apart. And AstraZeneca or Vaxzevria is recommended anywhere from 4 weeks, so 4 to 12 weeks apart.
Okay, great. Thank you. And what are the differences between those vaccines, as in which one's the most effective?
So the vaccines, as I alluded to, 2 of them are made up of what we call mRNA. And the second one, or the second type, is a inactivated viral vector vaccine. So they're the differences in regards to how they work in your body, if you like, or how they are made to work in your body. However, the efficacy or how well they work in the real world, they are all very, very similar. So once you have had 2 doses of any of the 3 vaccines we are offering in Australia at present, your protection against severe COVID disease is upward of 90%. So the way they work in the body is how they produce the immunity to COVID-19 vaccine, COVID-19 disease. But the result is...
Well, sorry, how does that work, immunity?
So the mRNA vaccines provide a vision of the spike protein of COVID-19, and they introduce it to the cells. The cells then recognise that as a disease and set up memory cells that will remember it the next time that you are exposed to it. So the mRNA, I suppose people see as a newer platform for vaccines. However, it has still been around for many years. The AstraZeneca vaccine, I suppose, uses slightly older technology in that it introduces the whole of the COVID-19 protein to the cell to produce that immunity.
We'll just swap interpreters.
Great, thanks, Sarah. And it's very interesting to understand further about the vaccinations. And I understand that obviously 90% efficacy is fantastic in regards to our protection from coronavirus. But I'm wondering if there are any side effects, and obviously they have said that there are side effects with each of the vaccines. So why is that the case?
So the side effects, or the common reactions that we see to any vaccines, are generally in regards to the immune response reactions rather than the vaccine themselves. So the most common things we see after all 3 of the vaccines are fatigue, so feeling more tired than normal, some muscle aches. Some people can get a mild fever or temperature after the vaccination. You can get a sore arm. We find that some people get a headache with the vaccinations that we give. They usually last 24 to 48 hours if you are to get them after the vaccination, and can be helped with general analgesia like paracetamol or ibuprofen or something you can buy at the chemist if you need it. So all three of the vaccines that we provide do have common reactions, as we've just discussed. I suppose one funny phenomenon is that we often find that with what we call the mRNA vaccines, so the Pfizer, Moderna vaccines, you will often see more of the common reactions after the second dose, whereas with AstraZeneca, you will often find that you get the common reactions after the first dose.
Interesting. Yeah, right. So do you know why that's the case in regards to the side effects? Can you explain a little bit further as to how they actually happen?
Yeah, so in regards to why one happens after, you know, one type of vaccine or after the first dose or the second dose, we're actually not really sure as to why one vaccine activates the immune system more after the first dose and one activates after the second dose. But it's certainly something that we've seen replicated all over the world in regards to when we look at safety for these vaccines. So we're still looking into why that occurs with these vaccine profiles. But the common reactions that we see in COVID-19 vaccines are the common reactions that we see with all of our vaccines. So all the vaccines, the childhood vaccines, the travel vaccines you may have received, all very similar profiles in regards to what you would expect in the day or two after having the vaccination.
You're right. And I actually have a question that's come through on Facebook. Just reading that now. So talking about overseas, obviously now there are booster shots that are being given overseas, or the third dose of the vaccine. Do you think that will happen here in Australia? What's the plan?
So yes, I do think that will happen in Australia. These vaccines we like to refer to as first generation vaccines. And so they are our first attempt, if you like, at being able to control COVID-19 in our bodies. So when we did all the testing for these vaccines, we went on a 2-dose schedule, and that was shown to have a good response in a majority of people that had normal, in inverted commas, immune systems. So those people that were not compromised in their immunity. And so, but because they are new vaccines, we were unsure, obviously, at how long the protection would then last. We knew we would get good protection from these vaccines, but we didn't know longevity of the protection. So therefore, some countries that are further ahead of us in the I suppose the vaccine race have decided that they will give third doses because they believe that it will give their population better immunity going forward. It is most likely that the first people here in Australia to get a third dose will be those that are immunocompromised, so those people that are receiving treatment that does lower their immune system, and those people that have something that affects their immune system working properly. There's been a lot of discussion about third doses in some countries because we are very conscious that a lot of the world is yet to have one dose of COVID-19 vaccine, and we are concerned that they may not have access to vaccinations as quickly as we have in Australia.
Good. So I might move along to the next question, Sarah.
Mm-hmm.
So if, let's say, for example, with Pfizer
Mm-hmm.
and Moderna, they're both an mRNA type of vaccine. So why do we have AstraZeneca, and why are we using a mix, or why are we focusing on the mRNA vaccines rather than AstraZeneca?
Oh, good question. It's a very difficult question. AstraZeneca vaccine is an excellent vaccine. So it is shown to be extremely effective against severe disease and death with COVID-19. I suppose for AstraZeneca vaccination in Australia, I suppose the press or the discussion around the very rare side effects in regards to AstraZeneca vaccine have really affected its uptake in the population that we would have loved to have had it. It has been shown to be very effective against disease, but also the longevity of cover is showing to be excellent. Likely to be better than Pfizer vaccination. That is still a work in progress, but that's certainly what it's showing at the moment from the studies that are being done overseas. So I suppose the reason we were using it here in Australia was that it is an excellent vaccine. It was something that we were able to produce here in Australia. We did not have any, or still do not have any, mRNA factories that are able to produce those vaccines, so that we knew if there were supply issues, as we have all seen this year, we would have something that we could make on the ground and therefore be available to the Australian public straight away without it having to be flown or shipped or anything like that. So we believe that it's still an excellent vaccine. It has been used in millions of doses around the world. But unfortunately, it fell out of favour in regards to the Australian public once the rare side effects were discussed around it.
That's right. It's really interesting to think about how the vaccines are actually made. So I didn't actually realise that the mRNA needed a particular machine or particular equipment to actually be manufactured, whereas AstraZeneca is the easiest option in regards to how we can manufacture that here in Australia. Interesting. I'm just looking to the other questions. So we have one question about how vaccines can actually, well, is there any bias towards any particular vaccine on which one is better than the other, for example?
No, so we recommend that people obviously get, if they have any concerns around the vaccines in regards to their own personal health and things like that, that they talk to a trusted health professional about what would be recommended for them. However, we have found that most people with most health conditions can have any of the 3 vaccines that we are offering currently in Australia. So we, obviously ATAGI has recommended that people under the age of 60 can access an mRNA vaccine if they can. But certainly many thousands of people under 60 have accessed AstraZeneca vaccine and found it to be highly effective for them. So we have discussions all the time with people with differing health conditions about whether we recommend certain vaccines for them. And a majority of the time we discuss with them the ATAGI statements that are on the health.gov.au website that have put out the recommendations in regards to vaccines, vaccine profiles, age ranges in Australia. And for those people, yes, for those people that are wanting to discuss maybe the different vaccine that maybe has been allocated to their age group, that is certainly something you need to have with one of your trusted health professionals. So whether that's your GP, whether that's your specialist immunisation service, whether that's your pharmacist, to discuss your individual I suppose conditions or your concerns, and see if you can make heads or tails of what you might like to go forward with.
Perfect. That's exactly what I plan to say. Thanks, Sarah. And I think it's really interesting about the 3 different options of vaccination that we have at the moment. But vaccines aside, I might actually ask, well, just to let people know about the Expression Australia Vaccination Hub that will be happening on Thursday and Friday. Can you inform the viewers which vaccine will be provided on the Thursday and Friday this week?
Not my area, but I'm sure there's someone on that can do that.
That's right. So I'm just calling upon someone else from Expression. Thanks.
Hi, everyone. Yes, I can answer that question. It will be the Pfizer vaccination.
Will it only be the Pfizer vaccination, Tiff? Why are we only giving out the Pfizer vaccine on the Thursday and the Friday?
So we're working with a provider called Healthcare Australia, and that is the vaccination that they have made available to us at this point in time.
Will
Great,
that be
thank
for
you.
all ages, Christ?
Yes, I believe so. Yep.
Great. So all ages, anyone can come in to the Expression Australia office to receive a vaccine, regardless of whether or not they're a client or a staff member. Is that right?
Yes, that's right, Olivia. We're opening it up to clients, the community, and staff. Yep. And as previously discussed in the communications, we are partnering with Healthcare Australia and providing a place where people can come and get vaccinated in an accessible and inclusive way, because we will have interpreters on site and making sure it's as accessible as it can be.
All right, great, thank you. And it will be nurses providing those vaccinations on Thursday and Friday. Will there be anyone else there to help inform deaf community members if they want to know more?
We'll have nurses on site, yes, that's correct. And they will be our main healthcare professionals. So I think if there's any questions that they are able to answer, that people can absolutely be asking them on the day. Yep. And we'll be setting up the vaccination clinic to make sure that we have a waiting area, a vaccination area, and also a observation area as well, and we'll be directing people as to where they need to go at what times. We'll also have people at the front of the building to be directing people where they need to go, which is onto level 3, and then also somebody at the entrance of level 3 to be directing people into the waiting room and providing consent forms and everything like that, and giving some directions on what they need to do.
That's great. That's great. And so can I just walk in and get a vaccine, or do I need to book?
Yep, so you will need to book in via the Healthcare Australia booking system, and we have sent out that link to anybody that's wanting to get vaccinated. So that went out on the social media post, and it's also gone out to staff as well.
Great. And why can't I just walk in and get a vaccine? Is there a special reason?
Look, we've been given the direction from Healthcare Australia that they need to have bookings so that they know exactly how many vaccinations they need to be ordering and how many we're able to actually administer to people. So that's why it's important, I think, for us to have a booking system. And also good for us as the premises, you know, hosting the vaccination clinic, so that we know how many people are coming and going into the building, and we can manage it from that end as well.
Yeah, great. Thank you. And just going back to Sarah, we've received a question online here, and it says, I've been fully vaccinated, but I've seen commentary around fertility and the effect of the vaccination on fertility. Is there an effect, or what, is that a rumour?
So this is a question we often get asked in regards to vaccines, especially with new vaccines. So there has been no support at all for this discussion in regards to the vaccine, the COVID-19 vaccines affecting fertility. We have had long discussions with our obstetrics and gynecology colleagues at Monash, where I work, and they have no concerns in regards to the COVID-19 vaccines and fertility. There have been studies done all around the world in regards to this when this is raised, and there have been no signals or no concerns raised about COVID-19 vaccines and fertility. So I often recommend my patients that wanting a discussion around this to obviously have a chat with their GP and things like that, but online we have a fabulous reference website called the Melbourne Vaccine Education Centre, and it has updated information, reports, studies, clinical guidelines, all those sorts of things on all things vaccination and immunisation, but especially at the moment, obviously in regards to COVID-19 vaccines. And I think they have some excellent guidelines on there around fertility concerns that people will have, as well as, you know, COVID-19 vaccinations and pregnancy and breastfeeding and those sorts of things as well. So Melbourne Vaccine Education Centre is highly recommended as a great website to start when you're looking for information in regards to this.
Great, thank you. And another question we've received online says, I have DVT in my leg. I don't know what DVT is. Would that stop me from getting the vaccination? Or if I get vaccinated, would it make DVT worse?
So great question. DVT is deep vein thrombosis. And it means basically you have a clot that's sitting in one of the veins in your leg. And that can either be deep in your leg, or it can be quite on top of your leg, if you like, or on the superficial or the outer inside of your leg. So no, having the COVID-19 vaccine does not affect your DVT in any way. So our patients with multiple DVTs, pulmonary embolisms, which are other types of clots and things like that, we have had thousands upon thousands and millions now, considering we've given almost 7 billion vaccines throughout the world. We have not shown that that has been an issue for people with DVTs, even current DVTs. And that goes for both the mRNA vaccines and the AstraZeneca vaccination. So obviously, if you are concerned, you have a further chat with your GP about your DVT. But we have many people, millions of people throughout the world that have a chronic medical condition that have received COVID-19 vaccines very safely, including those with DVTs.
That's great. Thank you for that answer. I can see another question, and they're asking around the AstraZeneca vaccine. They've heard that some countries haven't approved AstraZeneca. For example, in America, the FDA have not approved AstraZeneca. Why haven't they done that? Do you know why?
Generally, it's because they haven't needed to use it. So when the COVID-19 vaccines were being produced, and the AstraZeneca vaccine is a UK-based vaccine, so it was made in the UK and designed and produced and all those sorts of things in the UK originally. The US did not need to use the AstraZeneca vaccine because they had Pfizer being made on site. So if you think back to where we talked about before about being able to actually make the vaccine on your shores, that was a huge thing in regards to what vaccines were then able to be used in which different countries. So the FDA not having approved it as yet is no signal about how well it works or its efficacy or how safe it is or anything like that. It's basically that they just haven't needed to use it in the US to cover their population, so they haven't needed to look at it.
Okay, great. That's interesting. Yeah. I hadn't thought about different perspectives and different manufacturers in different countries and how that works. Yeah.
So they were very quick
to
get, sorry.
Yeah, go ahead, Sarah.
They were very quick to give money to other companies that were developing COVID-19 vaccines in hope that they would work and therefore be able to access those vaccines very quickly and in really large amounts, which meant they didn't have to go to multiple different companies to get the vaccine quantity that they needed.
Yeah, right. That's interesting how systems work, economies work, and rationing the vaccine and making sure that every country gets their share according to how much they've put in for it. It's a new world for all of us, I'm sure.
Mm-hmm. Yeah, absolutely. And we've seen, you know, if we look at like Australia sending vaccines to places like Papua New Guinea, you know, to our neighbours who need vaccines, who may not be able to purchase them as readily as we can, and we can certainly obviously make them here. So in regards to getting them to PNG, it's a much easier process than PNG, say, getting it from the UK or something like that. Quicker, easier, and then enables our neighbours to be protected as well, because obviously while COVID-19 is still circulating throughout the world, it puts us all at risk, whether we're in a vaccinated country or not.
I have a question around the spread of coronavirus. And so say a fully vaccinated person like myself and my partner's fully vaccinated, would we be more likely to get corona compared to a person who's one dose vaccinated or not vaccinated? How much protection does the vaccine give you?
So from actually catching the disease at all, if you are double vaccinated, so you've had your 2 doses, that is the recommended schedule, around 2 weeks after you receive your 2nd dose, you are considered fully vaccinated. Okay, so it takes that little bit longer, not just having the 2nd injection, to being considered fully vaccinated. It gives you coverage of about 50 to 60% from actually catching COVID-19 in the first place. So that's why you hear of some people that have been double vaxxed that will still catch COVID-19. Okay, so these vaccines were not designed to prevent transmission or contagion of disease in 100% of people. Okay, these vaccines were designed to stop people dying or having severe disease with COVID-19, and that's certainly what they've been able to do. So obviously, if you have had no COVID-19 vaccine, you have no protection against COVID-19, as you, it is what we call a novel coronavirus. So that means it's a new one. So your body will not have seen it before. If you have 1 dose of COVID-19 vaccine, it usually gives, we say, around 30% protection from catching COVID-19 disease and then being particularly sick and dying from it. But certainly you need to have that 2nd dose to get that good coverage against even catching the disease in the first place.
Yeah, good. That's interesting. So one question I've just been thinking about now. So if I get coronavirus, how long would it take me to shed the virus? Sorry, let me rephrase. How infectious am I if I get coronavirus? If I get it, how many people will I be likely to give it to?
As a vaccinated or unvaccinated person?
Yeah, so say I'm fully vaccinated, yeah, and I get coronavirus, and then what's the chance of me giving it to someone else?
So it does depend, we say, on your viral load. So that is how much disease you carry, say up your nose or in your mouth, that then can be expelled onto someone else. Okay, by coughing, talking, singing, yelling, all those sorts of things. So there's been some quite long discussion about this as to whether the vaccines actually reduce your viral load if you catch it, if you get what we call that breakthrough disease, if you've been double immunised. Whether that makes any difference to your viral load, it may not. You may still be as infectious as someone that hasn't had the vaccines. However, you are reducing your likelihood of catching it in the first place by being vaccinated by up to 60%. So as we said before, the benefit of being doubly vaxxed is that you are less likely to catch it in the first place. And if you do catch it, then you are very unlikely to be extremely sick or die from COVID-19. So absolutely, you can still pass it on to other people. Hence why we still have all the other mitigation strategies in place, such as social distancing, masks, the stay-at-home orders, those sorts of things.
All right, we'll just do an interpreter.
Right, so just another question here, Sarah.
Mm-hmm.
With overseas, they have the Johnson & Johnson vaccine. that particular brand. So why do we not source that brand here in Australia?
Yeah, good question. I'm not sure why we decided not to go with the Janssen vaccine, which is the other name for it. It is a single dose vaccination. So whether it was because all of the vaccine doses that were being produced were able to be used overseas and therefore they did not need the Australian market, or whether we just decided to use a couple of vaccines. There was no particular reason why we didn't use the Janssen vaccine when it became available, late last year, early this year. That was probably more a political decision rather than a health decision as such.
Great, thanks, Sarah. And I have one more question for someone from Expression Australia, if they're willing to join us on screen. Great. So we have one question about the hub on the Thursday and the Friday. Do I have to pay for the vaccine if I attend the Expression Australia hub?
No, you don't. No, there's no cost.
Great, thank you. And where and how are Expression Australia funding the vaccine? How are they providing it?
Yeah, so what the government has said is they're providing the vaccine for free to everyone. So we are partnering with a provider who is a part of that service. So there's no cost to us and there's no cost to the people that are coming in to get the vaccination.
Great. And why is Expression Australia forcing, or rather encouraging quite strongly, people to come and get the vaccine? What's the agenda?
Look, we are following, I guess, the government obligations that have been placed on us as an organisation in terms of encouraging our staff, clients and community to get vaccinated. And I think it's important that we are encouraging, but ultimately the decision is of the person. But we obviously want to make sure that we are providing a safe space for our clients, community and staff. But we are definitely not forcing anybody or directing anybody, but we are following our government obligations in terms of authorised workers.
Great. And I have another question that's come through. Actually, I think that may be all for Expression. Thanks, Tiff. So I have one more question, maybe two more questions actually, just in relation to the vaccine, and then we might wrap up with Sarah. So firstly, with the first vaccine, typically people have to wait anywhere between 3 to 6 weeks for the Pfizer vaccine. So why is there that waiting period between the two doses?
So what we're trying to do with the first vaccine is give some memory to the body, if you like, in regards to COVID-19 disease and what it looks like, okay? So we give, and this is for all vaccinations, we give one dose, and generally what the body does with that, it takes a couple of weeks to actually produce what we call an effective immune response. So that's so that the cells in the body recognise the COVID-19 or whatever other disease it is that we're trying to educate it with. And what we then want to do with the second dose is we want to then, if you like, strengthen that education in the body. So we want to make sure that the immune system really remembers what that disease looks like. And so therefore we want to make sure that the first vaccine is given and, if you like, dealt with. So it's the immune system has had a time to respond, make those cells that it needs to. And then when we give the second dose, that the second dose really activates that immune system response so that the body gets longer term memory in regards to COVID-19 and gives it stronger protection. So it means that down the line, if you are then re-exposed to COVID-19, your body can very quickly and effectively respond to the disease that it is being exposed to. And that's why you may get mildly sick if you've been doubly vaxxed with the COVID-19 vaccines. However, you will not get profoundly sick and die as a general rule after having the 2 doses of COVID-19 vaccine.
Right. So do you know why the government has chopped and changed between, the 3-week waiting period to the 6-week and now back to the 3-week? What's the difference? What's happened?
Yeah, so the studies, I assume we're talking about Pfizer vaccination here, because that's the one that's the 3-week gap. So the studies that were done for Pfizer were done at a 3-week gap. And so that was the original recommendation. However, we know that if you have 1 dose of vaccine, then it does not run out. So if you don't get your next dose for a period of time after it, it just acts as an increased immune response by having that second vaccination. In regards to the 3-week gap, so that's what was recommended at the start. We moved it out to a 6-week gap because at that time we wanted to get as many people in Victoria to have their first dose of Pfizer vaccination. And if we were trying to do all the second doses at 3 weeks for the people that had already had 1 dose, it just meant it was a much longer time frame for people to get a first dose. And we do know you get some protection from that first dose, and that's why it was so important when we were seeing our numbers rising and realising that we weren't looking for COVID-0 anymore, that we needed to get those doses into people's arms. It was also a supply thing. So we didn't have the opportunity to have as many appointments for first and second doses, so we did have to prioritise. So that's why we went to 6 weeks, and we've now moved back to 3 weeks because we now have doses available and we have a lot more people that have actually had their first doses, so we can catch up with those second doses now and make sure everyone gets the full protection from the vaccine that they've chosen to have.
Great, thanks, Sarah. So we just have one more question and then we'll wrap things up for this evening. So how does the vaccine protect from the new variants of COVID, such as the Delta variant? Will the vaccines that we're still delivering to people actually protect them from the Delta variants and other variants?
Yeah, great question. When we see diseases evolving, like we have been seeing with COVID-19, obviously it can be challenging to keep up with the changes. So the vaccines that have been developed have obviously used the spike protein as their main source of, if you like, immune response. And that spike protein tends to be relatively similar throughout all the disease incarcerations, or in the, I suppose, the different variants of the vaccine that we have seen. And so even if it is not an exact match for Alpha or Delta or something like that, you still get a lot of crossover in regards to the cover that the vaccine gives for the specific variants that we're seeing throughout the world. So the next vaccines that will be distributed, you may have heard that Pfizer are talking about variant vaccines and things like that. And so you may find that they are specific for different variants that they think are going to be the variants of concern next. They're hoping that with the mRNA platform, which is what they call the vaccine, I suppose the base of the vaccine, that they will be able to modulate new vaccines much quicker going forward in the future than they have been able to in the past, so that we can respond really quickly to any outbreak that may happen with a different variant. But the vaccines certainly give good protection against Delta, as well as all the other, iterations that we've had of COVID-19 previously.
Thanks, Sarah. And just the final thing from you, if I can, could you please let us know once more the website that you mentioned before, that you said there was plenty of information for anything vaccination. Can you refer to that website again?
Yeah, it's fantastic. It's called the Melbourne Vaccine Education Centre, MVEC, MVEC. And if people just search for MVEC, it will be the first one that comes up. It is run in conjunction with the Royal Children's Hospital here in Melbourne, Monash Medical Centre here in Melbourne, and the Murdoch Children's Research Institute. So it has lots of fabulous references on immunisation in general, and certainly we have a focus at the moment, obviously, on COVID-19 vaccines. But it's a really good Melbourne-based relevant information for us who live in Melbourne or in Victoria. It can be extrapolated for the whole of Australia as well, but I just find it a very simple, easy to read, informative website that I often recommend my patients to go to.
Brilliant, thank you. And thank you so much, Sarah, for your time tonight. And thanks for responding to all of our interesting questions in regards to vaccines that have come up for this evening. We really appreciate your time.
Pleasure, anytime.
Great, thank you. So in future, Expression Australia are hoping to establish our Vaccination Hub, which will be on Thursday and Friday at the JML Centre, or the John Lovett Centre, on level 3 in our East Melbourne office. And then down the track, when people are ready for their second dose, we will also be establishing that hub once more. And we'll have interpreters who can work closely with the nurses or the vaccination staff on site. And there'll be support workers available as well on site, just to ensure that everyone who is receiving the vaccine at our East Melbourne office is feeling safe and secure and comfortable to communicate in their first and primary language. We really encourage everyone to come together and consider taking a vaccine, just due to how everything's looking at the moment. It looks like the way of the future, and the way to get back out there and to socialise again and enjoy and embrace our culture in the flesh and face-to-face will be thanks to having the vaccine. And then hopefully in short time, we'll be able to enjoy each other's company once more in the flesh. So please, if you have any concerns or further questions, do get in touch with us. And you can, if you are considering coming to the hub at our East Melbourne office, please make sure to book in beforehand. We have a very particular number of doses that will be ready on site due to you having booked online. So if you're having any issues making a booking online, please do get in touch with us via Facebook or email, or call someone directly at Expression Australia. You can call the Expression Australia reception or front desk tomorrow as well during business hours. And again, just a reminder, the vaccine is free for all those who wish to have it. And if anyone else is here and would like to add a final comment for our wrap up from Expression, you're welcome to do so. Otherwise, we'll wrap things up. I actually just see one more question here. in regards to the Expression Australia Hub. So when people come to get a vaccine, will people such as the nurses and interpreters and staff be wearing masks? I'm just worried that this might impede my ability to communicate. So can someone from Expression come on screen and answer that question? Thanks.
Great question. So we will ensure that we are working with the nurses prior to them coming in terms of communication and working with interpreters, etc., and particularly around mask wearing. So we'll make sure that it is accessible and that, you know, masks are being removed when they need to be in a safe way.
Great, thanks, Tiff. Do you have anything else you'd like to add about Thursday and Friday sessions for the vaccine?
I don't think so. Just making sure that, yeah, you're booking in and, yeah, making sure that you're following the prompts in terms of how we've got the hub set up. And no, I don't think there's any more information to provide at this stage.
Great, thanks, Tiff. And thanks again. And a reminder to all of our staff, community members, our clients, please do let your friends and family know as well that we have this available to you, and you're welcome to join us on site to get your vaccine. Thanks, everyone. Have a good evening. And thanks again to you, Sarah, for your precious time that you volunteered tonight. We really appreciate it. And thanks to the interpreters as well, just to make sure that all the deaf community can gain that information. Thank you.